What is the role of brain imaging in terms of a stroke? So once a patient comes to the ER with stroke-like symptoms, the first thing that's going to be done is a CT of the brain without contrast. Contrast is also dye. That's used in radiologic procedures. And that serves to show that there's no intracranial hemorrhage or a head bleed. Once the CT of the brain rules out a head bleed and the patient is screened to see whether or not they're a candidate for blood thinners, they're going to be considered for TPA or intravenous thrombolytic therapy. After that's done, an MRI of the brain will also be performed to look at the actual dead brain tissue. And let's say the patient arrives between 4.5 to 24 hours, they may still be a candidate for TPA or intravenous thrombolytic therapy if their MRI shows brain tissue that's at risk and it's viable, that they have the emergent thrombolytic therapy available emergently, and if there aren't any contraindications or reasons to not have or give that therapy to the patient. And usually what that will allow is the patient can receive this medication. There are 2 more tests that are performed in patients who have strokes on the head. There's a CTA of the head and the neck, and this is used to identify large vessel blockages in the brain. These vessels, if blocked, can actually be opened up with specialized trained physicians at stroke centers. And the idea of opening up the vessel, similar to a heart attack, is to stop any further brain tissue death, because once you lose your brain, you can't easily regain those cells and that function. If this is identified, the patient will be transferred immediately to such a stroke center that has the capability to perform this procedure. This has to happen fast to get the patient the care that they need in order to reverse the extent of the brain death from the stroke.